Hey everybody, today I want to go over the top 10 questions that we receive from people who want to get a second opinion about their options for premium cataract surgery or lens replacement surgery, or patients who may have already undergone premium cataract surgery or lens replacement surgery. They already have a lens implant, they had surgery elsewhere at another practice, but they're not quite satisfied with how they see, and they want a second opinion to know their options for optimizing their vision after already having undergone surgery. Question number one, how often do patients travel from outside of Texas or even outside of the country to come see us for a second opinion about having premium lens replacement or cataract surgery, or they come to see us because they want a second opinion after already having undergone lens implant surgery elsewhere? Well, let me show you something. In our office, there's a map. Let me just focus in on it. The pins on this map located at our Westlake office show the locations and cities of patients who travel to come see us for a second opinion about correcting their vision. We see patients from all corners of the United States and outside of the United States. And in the United States, people have even traveled from Alaska to come see us for their eye surgery. It's quite an amazing journey that these patients go on. Question number two, can we tell you if or how we can correct your vision if you email us or call us, but we've never seen you in person as a patient in our practice? Unfortunately, the answer is no. In order for us to give you worthwhile, credible answers to your questions and to offer recommendations that are substantive and of value, we have to see you in person in one of our offices here in Austin, Texas. Unfortunately, we can't offer medical advice via virtual consultations, telemedicine, email, or phone consultations. So question number three, why can't we answer your questions virtually or if you email us or call us with your information? It's because we need to obtain a library of diagnostic tests of your cornea, your retina, the spatial dimensions of each eye. We need to understand the retina condition, your optic nerve condition. There's a whole host of data points that we need to obtain in person. Plus, we need to get to know you. You need to get to know us. That relationship has to be formed. And we need to physically look at your eyes through a microscope to ascertain all the subtle details that we need to know in order to determine what your best options are. Question four, what if you send us all your medical records? We review them. Then can we answer all your questions? Unfortunately, no. We still need to see you in our office for the reasons that we mentioned earlier. And if travel to our office is not realistic, we completely understand. Question number five, so how often do patients travel from out of state or out of the country to come see us? Pretty much every day we see patients traveling from far and wide to come see us for a second opinion, so it's pretty common. Question number six, how much does eye surgery cost? Like all things, it depends. It depends on what we find during your eye exam and how you want your vision corrected. But let me give you a general idea of the cost of 5 of our most commonly performed procedures that we offer to help people see better, ideally without glasses or contact lenses. On this chart, which we update on our website, austineye.com, on the second to bottom row is the patient charge per eye for premium lens replacement for the various premium lens implants that we use. If you're having premium lens replacement surgery, then you don't really have a visually significant cataract, and therefore insurance is not used to cover any of the costs of cataract surgery. The patient is fully responsible for paying out of pocket for the charges for elective premium lens replacement. Now, on the bottom row, that is the charge to the patient per eye for situations where the patient has medical insurance and they have a visually significant cataract and they want to have a premium lens implant. The cost structure for this category of patients is less than the cost structure for patients that are having purely elective premium lens replacement. For basic cataract surgery, if you have medical insurance that we accept, then your out-of-pocket expense per eye is your copayment and unmet deductible. If you're choosing to have basic cataract surgery with a monofocal lens and you don't have any insurance, then the cost is about $4,555 per eye. If you've already had lens implant surgery elsewhere and you come to see us and you end up undergoing intraocular lens exchange, also known as IOLX surgery, where we remove your existing lens implant and replace it with a different premium lens implant, then the cost per eye is $10,000. If you're going to have intraocular lens exchange, you've had your lens implant placed at a outside practice and we remove that implant and replace it with a basic monofocal implant, then that service is generally billed to your medical insurance. So your out-of-pocket expenses, your unmet copayment and deductible. Finally, if you're interested in having your vision corrected with LASIK surgery, then our charge is about $2,800 per eye for a customized wavefront guided all laser LASIK procedure. During your eye exam in our office, we'll be able to give you a very specific quote on what your out-of-pocket expenses will be for any eye surgery that you choose to have, and if your insurance can help cover some of the costs of your eye exam or your eye surgery. Question number 7. Is there a window of time by which a person who has already undergone cataract or lens implant surgery has to make a decision about whether or not they're going to undergo intraocular lens exchange? Yes and no. So in general, it's easier and more straightforward to perform lens exchange or intraocular lens exchange surgery within the first 3 to 6 months after receiving an implant. And it's definitely more straightforward to undergo intraocular lens exchange if you have not had YAG laser capsulotomy after receiving your implant. However, do we sometimes do intraocular lens exchange more than 6 months, more than a year, more than 2 years after a patient has received their original implant? Yes, we do. But if you choose to undergo intraocular lens exchange years after receiving your first implant, that procedure can be much more complex than it would have been had you not undergone YAG laser capsulotomy or had you done your intraocular lens exchange within the first 6 months after receiving your implant. But for every problem, there is a possible solution to help you, but it's very customized, and the longer that your lens implant has been in your eye, the more work or more challenges we'll have to overcome to exchange and replace your first implant with a second implant. But it can be done. And we're going to be more selective about doing intraocular lens exchange if you had your original implant placed more than 1 year ago. Question number 8. Let's say you're traveling from far away to come see us and you want to know how much time do you need to block off of your schedule to come in and have us do your initial eye exam, do surgery to one or both eyes, and perform your follow-up. Generally, we can do all of that in about 7 days or 1 week. Now, let's say you've already had surgery, you've returned home, and it's a month or a few months after your original surgery and you feel, hey, I don't think I'm seeing quite right, and you email us or call us and go, I can't see quite as well as I want. Why is that? And what can we do to correct that? Well, in order to answer those questions, we will again have to have you come back to Austin to see us for an in-person exam. Question number 9. How does one start the process for coming to see us for a second opinion? Well, before we answer that question, I would like to make 2 suggestions. Number 1, work with your original surgeon who did your surgery and try to exhaust all options that your original surgery can offer you, because the original surgeon met with you, they know you, they understand what your goals were at the beginning before you had surgery. Now they're seeing you after surgery. Work with them together to find a optimal solution for anything that bothers you about your vision. Secondly, if for some reason your original surgeon is unwilling or unable to work with you to correct your problem, then find another local reputable ophthalmologist in your city, in your community, who is willing to work with you on a second opinion basis. So if you're coming to see us, really it should be after you've exhausted options locally. Now, if you come see us, we're happy to see you, but that may involve you jumping through a lot of hoops to travel and come see us. Now, let's say you've already gone through and exhausted all your local options and you definitely want to come see us. Well, you can call our office. Our number is listed on our website, and our office staff will walk you through the process of scheduling your initial exam, and we will reserve time for any potential surgery should you choose us to surgically correct your vision. Before you travel to see us, however, we want 2 pieces of information that are super crucial to planning any options if we're going to do more surgery for you. Number 1, we want to know the optical biometry measurements of your eyes that were obtained before you had your original cataract surgery or premium lens replacement surgery. These optical biometry measurements are also known as a lens star, an IOL master, or an Argos measurement. These measurements tell us the length of your eye from front to back, the focusing power and shape of your cornea, and all the interior technical specifications and spatial relationships of your eye. The second very valuable piece of information that we want is for you to find the exact lens model and power, often given to you in the form of a lens implant card immediately after surgery. If we know what lens implant you have in your eye that you're not happy with, and we know the focusing power of that lens implant, and we want to adjust the focus of your eye, it's helpful to have that lens implant specific information and the optical biometry. So please, if you can bring those with you before you come see us, that would be awesome. And finally, question number 10. Why in the world do patients travel from far away to come see us? From all 4 corners of the continental United States, from all over North America, and from all over the world? Well, I think it's because the YouTube algorithm has brought you to one of our videos. And a lot of patients have found us that way. But importantly, are we worthy of the journey that those patients take? I would say absolutely yes. Why is that? Because we have devoted a Herculean amount of effort to develop an elite team of ophthalmologists, optometrists, nurses, technicians, and administrative staff to deliver an exceptional customer experience and to deliver the very best surgical and medical eye care, period. Also, we're experts in premium lens implants. We've placed tens of thousands of premium lens implants over the years, and we know their strengths and their weaknesses. And remember, there is no perfect lens implant. Every lens implant can have potential side effects that you might notice. and which might give you reason to be dissatisfied with how you see. It's our goal to work with you to manage expectations, and then if we jointly decide to do additional surgery to optimize your vision, that we keep it real, we disclose everything good, bad, or different about the surgery that you're going to potentially undergo, and we make sure you have a realistic expectation going into surgery so that your outcome is as good, if not better, than what you expected going into surgery. And because we've placed tens of thousands of these premium lens implants, and we've had to work with patients who were unhappy with their visual outcome, which tends to be about 1 to 2% of patients who receive these implants. They don't like the way they see for some reason. We've had to work with them to solve their problem that they're experiencing after surgery, and that has involved different types of lens exchanges or doing LASIK after premium lens surgery, or any number of corrective surgeries to help bring a patient into their best focus. Now, sometimes even we can't fix you. Sometimes we have to refer you out to another super subspecialist, or we may just have to level with you and go, you know, even though you're not seeing as perfectly as you want, this is why, and I think you should just leave your eyes alone, not have additional surgery, and if you need to see your best, maybe a contact lens or glasses is your final best solution. How often do we do intraocular lens exchange for patients who've had surgery elsewhere who come to see us and they want to have their first lens removed and a different lens placed? It's pretty much every week. And finally, let me just say that we have outstanding staff and outstanding facilities. We have our own ambulatory surgical center at our Westlake office, and we have our own LASIK suite also at our Westlake office. In conclusion, let me just thank you for investing your time in watching this video, and I hope it helps answer some of the most commonly asked questions we receive for patients who want to come see us for surgical consultation or a second opinion. Have a wonderful day. Bye-bye.